This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, you probably know the feeling. You eat a meal and then you feel the discomfort, the acids coming up your throat. We're talking about acid reflux, and millions of people get it every day. But for some, the problem is very serious. It can lead to something called Barrett's esophagus, which is a precursor to cancer. Joining us today to tell us more is Dr. Halim Charbel, a gastroenterologist with Peninsula Regional Medical Center. Thanks for joining us this afternoon, Dr. Charbel. First of all, let's start off. What is Barrett's esophagus?
Barrett's esophagus is a change in the lining of the esophagus that occurs when the esophagus is exposed to the acid from the stomach, and that can be a pre-malignant condition that can lead to esophageal cancer.
And we have the pictures here with the normal esophagus and then the Barrett's esophagus, right?
Yes, so with acid exposed to with the esophagus exposed to the acid from the stomach all the time, the normal tissue cannot handle the acid, so it changes, it adapts, and these are new tissue that form, and these are cells that are pre-malignant. So with time, these can progress to cancer.
Okay, now many of us get acid reflux every day. How do we know we have a serious problem?
Many people have acid reflux, and sometimes you have some mild acid reflux that occurs after a big meal or something like that, and most of us treat it with some over-the-counter medication, and that's okay. But if you have acid reflux on a regular basis, every day, more than 3 times a week, or if you take some anti-acid medications for a couple of weeks and you continue to have symptoms, then definitely you need to be checked. If you have symptoms at night, you go to bed and you have bad acid reflux, then you definitely need to be checked. And if you have any symptoms suggestive of potentially a tumor in the esophagus, such as a difficulty swallowing, feeling the food gets stuck in your food pipe, then you absolutely need to be checked.
Right, right. Is there a group of people who are more at risk of developing Barrett's esophagus than others?
So as we said, acid reflux is the major risk factor, but if you are a male, a Caucasian male, that is overweight or more than 55 years old, these are the major risk factors that increase your risk of developing both Barrett's esophagus and esophageal cancer.
All right. So what about screenings? How do you screen for Barrett's?
So when someone has chronic acid reflux and they fulfill these criteria, we take a look with an upper endoscopy. So the patient comes to the hospital, we give them some medication, they fall asleep, and we go in with a flexible tube with a camera and a light from the mouth down to the esophagus. We see if there is Barrett's esophagus. We take some small pieces of tissue, biopsies, to determine if there is Barrett's esophagus or not. And if it is, we determine on the biopsy if there are changes in the cells that are changing toward cancer, so we need to do something about it before it becomes actual cancer.
Right, right. And that's the good news. Barrett's esophagus is treatable?
It is treatable. The big thing is that we really need to know about it, know that it's there. But when we find it, the standard recommendation is that we do surveillance endoscopies. So again, we look and see if there are changes toward cancer, then we do something about it, either by resecting that segment or by newer techniques that allow us to ablate the Barrett's esophagus before it turns into cancer with an endoscopy. So it's an outpatient procedure. Patient comes, goes to sleep, we go in, take a look, and we burn this segment of the esophagus, a very superficial burn, and allow new normal cells to form at the place of the Barrett's cells to decrease the risk of this progressing into cancer.
Now, Dr. Charbel, we've seen all the ads for the acid reflux medications, over-the-counter medications. Do they really cure acid reflux? Do they really help? Or?
They do help mostly with the symptoms, but also they block the acid from the stomach, so it doesn't stop the reflux, but it helps with the heartburn. And if you do that, yes, definitely there is significant benefit in preventing the progression of these cells toward Barrett's esophagus and potentially the risk of esophageal cancer. But again, it's very important to talk to your doctor and get evaluated before you are taking these medications long-term without any evaluation.
What are some other preventative measures?
So most importantly, obesity is becoming a major issue in increasing reflux and increasing, we think, the prevalence of Barrett's esophagus and potentially esophageal cancer. So definitely avoiding obesity, maintaining a healthy weight. 2, don't eat very late at night and go to bed at night. If you're having symptoms at night, again, get evaluated. And if you have persistent symptoms of acid reflux, talk to your doctor, see if you need to be screened.
Are there any foods that we should avoid, absolutely avoid with this?
Well, there are no foods that cause this in everybody, but some people have certain foods that aggravate their symptoms. So for the symptoms, it depends on the person, but also avoiding fatty food, avoiding all the good stuff, chocolate and
Yeah.
peppermint and all that stuff that can increase the reflux, but also more importantly, avoiding eating and then laying down immediately after that, because that can increase the reflux.
All right, and the bottom line, if you feel like you have a problem, consult with your doctor, right?
Absolutely.
All right, Dr. Charbel, thank you so much. And of course,
Thank
if
you.
you'd like to read more from PRMC about Barrett's esophagus, go to delmarvalife.com and click on the show tab. Still ahead on Delmarva Life, do you know what these are? Or maybe you know what this is. We'll speak with one man who explains how this stuff is part of our history. But next, seems like we're hearing about more people being charged with their 5th, 6th, 7th DUI. How does this keep happening? We'll discuss it, plus get some insight on a couple of cases involving alcohol that have been making headlines recently. We'll be right back.